What's in your hair? Well, it seems like these guys might know. Welcome back, friends of Ai4Autism. In this episode, we'll be taking a look at this StrandDx article called FDA cites hair-based autism diagnostic aid as breakthrough. Well, let's go through it now. The US Food and Drug Administration, the FDA, has granted breakthrough device designation to a hair-based test designed to aid autism diagnosis. The acknowledgement shifts the test into a fast lane through the agency's regulatory review process. The test, called StrandDx, analyzes the level of chemicals in a strand of a child's hair to capture a snapshot of her exposome, some of her cumulative environmental exposures, and how she regulates certain essential nutrients. Interesting. The measures suggest how a person's physiology responds to her environment, which can predict her chances of having autism, says Manish Arora, Edith J. Berwald Professor and Vice Chairman of Environmental Medicine and Public Health at the Icahn School of Medicine at Mount Sinai in New York City, and co-founder of the New York-based Linus Biotechnology, which is developing the test. That was quite a mouthful. Now, previous research from the test's makers suggests that autistic people's teeth contain atypical levels of some metals, and that information can be used to predict autism diagnosis. I never knew about that. I should take a look at it sometime and make a video on it. With further development, StrandDx could also help identify subtypes of autism and predict prognosis and who might benefit from which therapies, Arora says. We're not just saying this is a diagnostic tool, Arora says. This is something we will help deliver therapy over time and chart the patient journey toward a healthier future. I hear Ai4Autism. Other experts say it is difficult to evaluate the technology without knowing more about what markers it analyzes and how it compares with current gold standard diagnostic methods. Arora says his team has submitted a paper for review that outlines how the analysis works, but he declined to share it with Spectrum, citing the journal's embargo policies. Okay, fair enough. Let's move on to this bit here. Analyzing hair samples makes it possible to look at chemical exposures and how the body regulates them over time, Arora says, similar to how the rings of a tree can reveal its age and changing environment. He then goes on to say, to use StrandDx, a clinician would request a kit to collect a hair sample from a child and return it to the company. The company would then provide the analysis to the clinician to use in conjunction with other information such as behavioral observations and family history. Arora says the technology is intended to help predict the likelihood that a child has autism from birth to 18 months of age and assist in diagnosis from 18 months to 21 years. Absolutely fascinating. So what I would suggest is, if you're interested, take a look at the link over here. I love this, using technology to help diagnose, provide therapy, and make those positive lifestyle changes in people's lives. Thanks for watching. What do you think of this article? Chime in down below, leave a comment, and remember, love, life, and hair.